Another pharmacist intervention is I had a patient who was on like a higher dose of hydrochlorothiazide, and she told me that she kept going to the hospital for hypokalemia, like low potassium levels, and she kept having like heart fluttering symptoms, and she's getting like a potassium supplement. So I just recommended maybe talking to her doctor about switching to a calcium channel blocker like amlodipine. It's another first-line option for hypertension or high blood pressure. And it doesn't waste potassium. It's not a diuretic. Another intervention I had is a patient who was on Pulmicort 90, and he was experiencing a lot of wheezing, basically uncontrolled asthma. So I recommended talking to the doctor about either increasing the Pulmicort, or actually I wanted him to switch to Symbicort. I thought that was a better option, especially if you're symptomatic, like on your ICS or inhaled corticosteroid. So Symbicort is recommended. Virginia guidelines is like as needed, and then also maintenance therapy. It's called SMART therapy, single maintenance and rescue therapy. Then the last intervention I had was a patient who was picking up Synjardy, metformin, and Jardiance. Synjardy is a branded combo pill of metformin and Jardiance, or empagliflozin. So when patients get prescribed things, they don't really know that they're supposed to stop what they used to be on. Like there's some sort of like gap in communication that I see a lot of the times, where when patients are switched to dual pills or the doses are changed, they just keep taking what they have already been taking and then the new medication they start taking. So I told the patient, yeah, you're not supposed to be on the metformin and the Jardiance anymore. I'm like sure that your provider is switching you to Synjardy, one dual pill, for convenience, because he thought he was supposed to take all three.